Good morning, ladies and gentlemen. Good morning. You are still sleeping. You guys still sleeping, huh? Anyway, thank you so much for joining our first talk show, Connect with Dr. Lowly. In case you do not know who is Dr. Lowly, I am Dr. Lowly. And I will be your host for today. Of course, we're going to have a morning of fun. Those people who have missed out this show, they are going to miss a lot of fun this morning. And of course, thanks to our sponsor, BioCare, you're going to walk away with lots of goodies as well today. I understand there's a goodie bag. I hope everybody have a goodie bag. You have a goodie bag? It should be on your chair. If not, look for Joyce later, okay? And of course, this is going to be the first of its kind in Singapore, because I think most of you guys have attended all these health talks before, right? It's basically a doctor or some speaker standing down there and telling you all the statistics that will show that how many people die of cancer in Singapore, what can you do. It's very one-way kind of a talk. So today we're going to do it very differently. We're going to make it very interactive. So with that, I would like to maybe invite 3 members from the audience to come here. And of course, if you can come up here, we have a goodie bag for you as well. So can I have a volunteer? I pick, okay. Maybe we have William. Let's give him a round of applause. And we have somebody from the former DHA Drug House of Asia, now Activa, right? Come, Actavis, come. And of course, we would like to have a lady, but I think ladies are generally more conservative in Singapore. So we have a young lady instead. Who is the youngest lady here we can find? The one who sat next to that lady with very colorful shirt. What's the name? Nat, is it? Can you come on? Come. Scared. Come. You're scared. If you're scared, then we have the mother. Okay, we have the mother then. Okay, as usual, they are usually very scared. So can we have a lady volunteer? How about Heidi? Where are you? There. Heidi, come. Let's give her a round of applause. Brave girl, come. How many of you have seen a lizard before? Heidi, are you scared of a lizard? Or are you scared of cockroach? I have something here for you. It's a cockroach. Scared? No. She's not scared of cockroach. I think generally speaking, Singaporeans are very scared of cockroaches, lizards, and but ironically, not many people are that afraid of things like mosquitoes. And of course, I spend a lot of my free time at home catching lizards. I came up with all kinds of tools, stickers and baits to trap lizards. Because lizard is, I'm sure you all don't like this pest, right? Do you like this pest? They go around droppings, black and white things on all your plates and so on. And sometimes when you wake up in the morning, you just take your cup and you pour hot water, your coffee, and stir a bit and you drink it without realizing it. So for a start, I think it's a good tip. Always invert your cup and your plates and bowl upside down. And next day, try to rinse it and wash it before you use it as well. Cockroaches. How about cockroaches? This little crawly. In Chinese, we call it 小强. You know what 小强, right? They are very tough. You can try to kill them, but they claw all over the places. You're scared of cockroaches or not? Guys? William, are you scared of cockroaches? So what do you do when you see a cockroach? You leave it alone. You leave it alone. You leave it alone.
Actually, cockroach scared of fragrance. So the way to solve the problem is to put some pandan leaf and maybe some soapy water. That's a good way.
BioCare, you heard that? We have a competitor, pandan leaf. How about you? How do you get rid of cockroach?
Basically, it's quite clean in the house. So what I do is, if I find a cockroach, I get a plastic bag and just get it and throw it away.
You're not afraid of cockroach?
Not that much, lah. Not that much.
How many of you brush your teeth at night? You brush your teeth? You? You don't brush your teeth? You really don't brush your teeth?
Early morning, yeah.
Okay. So we know somebody don't brush his teeth at night. That's interesting. So you only brush your teeth in the morning?
Yes.
Okay. You brush your teeth how many times a day, Eddie? 2 times. Why 2 times?
During the night when we sleep, we have saliva. And then when we wake up, our saliva might smell. So we brush our teeth to start the day. Then for at night is throughout the whole day, we have been eating a lot of things. So we'll also brush it off before we sleep.
How about William?
I just feel more comfortable before I sleep. So usually I brush mine.
I think I better sit further away because he didn't brush his teeth this morning. Well, we all have to brush our teeth before you sleep because the whole day I'll be eating a lot of, food, and all these little food particles actually get stuck, around your teeth, and it can cause caries, and, it's actually the food for all the bacteria. Our mouth is full of bacteria, and you don't brush it off, actually, you're going to get more prone to infections. And of course, most people will just brush their teeth. Do you floss your teeth at all? Any one of you? You do? How about you? You don't floss your teeth? Okay. Okay. I think it's important to floss your teeth as well. I'm not a dentist, but I realized something that, when one day I went to my dentist and it showed me an experiment. You can try it at home. Try, to get a glass of water, rinse your mouth, okay? Rinse your mouth thoroughly and look at the amount of particle. Put it on one side. Okay, then you go and brush your teeth with all the Colgate, whatever you want, and then after that, rinse your mouth and then get another glass of water, gargle it and pour back the water, spill it back into the glass, and then compare the amount of dirt in the second glass with the first glass. You'll see there's a lot of debris inside. This is the amount of dirt you get rid of, through brushing your teeth. Now, the third thing I want you to do, go home, try this, okay? Now, try to floss your teeth, okay? And then after that, do the same thing again, gargle your mouth and spill back the water into another third glass of water, and you compare the amount of dirt that came out after flossing. You'll be surprised that actually the flossing has taken up more dirt than you can imagine compared to brushing. So brushing your teeth itself is not enough. You have to floss your teeth as well. This is part of general good oral hygiene. I think our ENT specialist later on can share more about this, okay? And how all these little things that we do can help to prevent you from getting throat infection, sinus infection, and so on. Of course, if you brush your teeth, what do you do with your toothbrush after you brush your teeth? Heidi?
Try to sprinkle it dry.
Okay, sprinkle it dry.
And then keep it at a container.
In a container. What kind of container do you put in?
It's some kind of cylinder container.
How about you?
Basically, after cleaning it, I just put in a cup, standing, so that it can dry off. Yeah.
William? Same. I did the same thing long time ago, like what these two gentlemen did. And one evening, almost past 12 midnight, I woke up and I realized somebody is using my toothbrush. Guess what I found on my toothbrush? A big fat cockroach. A big fat cockroach was chewing away all the food particles from my toothbrush. From then on, I learned one lesson, that never share your toothbrush with anybody, and never ever share your toothbrush with cockroaches. Scary, right? You didn't know that. So what I did is I went to Daiso and I bought this little toy, this little container. This little container is very useful because you can just put your toothbrush inside. And then it prevents the cockroaches from coming in and, sharing all the food you eat the whole day. Remember that this is little tips that you can do, okay, for your own personal hygiene. And of course, in the past, I used to travel a fair bit, and I traveled to a different part of the world to do mission work. And one of the places I went to is third world countries. And sometimes in the front line, you have no choice but to stay with your fellow volunteers from different parts of the world, third world countries. And I, as usual, leave my toothbrushes around and my toiletries around the toilet. We share the same room. And then the next day, I realized that somebody has been using my toothbrush. Some people from the third world country actually have never learned how to brush their teeth before. So when they see toothbrushes, they are curious. They actually use your toothbrushes and use it to brush your teeth. So if you are traveling with somebody other than your spouse and your loved one, I mean your spouse, okay, who knows you well, try to keep your toothbrushes, okay, in the safe where possible. Because you never know who else is going to use your toothbrush, okay, in the middle of the night. It's quite scary. So you see, these are the known danger that we know. Lizard, cockroaches, mosquito, and of course mosquito now is a big thing because there are dengue outbreak everywhere. And dengue outbreak comes about because of mosquito carrying viruses. And all these viruses go around infecting you, and you can die from dengue fever. So of course, if you are living in Singapore, where it's always raining, and then some people like to keep plants at home and so on, please make sure that you empty all your little container of stagnant water so that you don't end up suffering from dengue fever. I just got a call from a friend who was down with dengue fever. And then his wife, his children also came down with dengue fever. And you can die from dengue fever. So do yourself a favor and every Singaporean a favor by making sure that there's no stagnant water lying around. Of course, rats is not so commonly seen nowadays. Are you scared of rats, Heidi? You're scared of rats. Have you seen a rat before? Yes. What's the biggest rat how big is the biggest rat you've ever seen? This big. So what do you do with it?
I run away.
You run away. You scared of rat, dog? No. What do you do with them?
Just leave it. I used to keep white rats, when I was young. So like.
I'm talking about black rat, not white rat. White mice, okay? We call them mice, not rat. I think rats, of course, can also, transmit diseases as well, because they are pretty dirty. They claw around all the dustbins and so on, especially the HDB flat, They go up all your dustbin tubes and so on. But I think there are hidden danger everywhere that you do not see. And today we want to focus on that as well. How many of you know, since you stay in Singapore, what is a vampire car? Nobody knows what's a vampire car. Do you know? You drive? You don't know what's a vampire car? You read the newspaper or not? The weekend car is called a vampire car because they only come out at night. But there are many things that you don't see, okay, that do not come out at night. They are everywhere. They are hidden everywhere. And you'll be surprised all the dangers that you're exposed to, the hazard that you're exposed to. The obvious one you can see, for example, I went to Kenya and I visited this cow dung hut. And all these children actually, because they're living in the environment where it's plenty of cow dung. And then in Kenya, if your children and your house has a lot of house flies, you are considered very rich. Because if you have lots of house flies, means that you have lots of cow. You have lots of cow means you're very rich. Okay? So these children will have a lot of flies around them. And from a distance, I thought, because I was going nearby to look at them and trying to take photographs, I thought, how come these children got mustache? Then when I got near, then I realized actually it's a string of house flies. So this is what we know about personal hygiene. It's so obvious. But there are hidden danger that you don't see in our daily life, that you're not so concerned about, you're not so conscious about, such as your handphone. How many of you bring your handphone to the toilet? You do? You also, right? A lot of us bring our handphone to the toilet and we watch ads, we Facebook, and then we wash our hand, and then after that, we carry on the handphone and then we go around talking like that. Actually, the handphone is one source of infection. And then when you flush the toilet, some of the things will spill onto your handphone. You do not know the danger. So these are the common danger you watch out for. And the other things that you have to watch out for is actually the keyboard. The keyboard. Many of us actually eat in front of a computer. And all the food particles are stuck down there. And sometimes halfway through typing, you hachi. And then, all the particles and liquids are all stuck in between the keyboard. Actually, this is from Terence. I took it from the office. I was tempted to just show you, by knocking on a piece of paper and show you the amount of dirt that came out of it. But I'm sure he's going to get embarrassed if I show you, okay? Because there are lots of dirt inside here, okay? So you really have to, once in a while, knock, and then try to sterilize the keyboard with just simple things like alcohol, or BioCare, for example. It helps to kill some of these germs that are harvesting inside. It's very important. These are the common things that we take for granted, and this can be a threat to you as well. Can you just smell your hand? What do you smell in your hand? Menthol. He smells menthol. How about you? Why are you guys laughing? This gentleman said he smelled menthol. Where do you think you get the menthol from?
I think it's going to be embarrassing. Probably from you. I was shaking your hand.
That's right. Everybody who has shaken my hand, please smell your hand. You smell menthol? Do you know I just sneezed? I purposely put some menthol in my hand and I went around shaking all your hands. Okay? Just to prove one point that actually I have been responsible in passing germs to you and you're not aware of it. Of course, the gentleman knew because when he shook my hand, he was a bit awkward. He felt, hey, how come this hand a bit oily? But, I'm the talk show host, so he didn't want to ask me, hey, your hand dirty. The point is, you see, if you get menthol in my hand, you can smell it. But if you get my flu viruses and all the germs in my hand, you may not know. And a few days later, you may just hachi and then you die of the flu. So what do we do about all this health hazard that is lurking everywhere? Do we take protections? Do we take preventive measures? You have a computer, right? You use a computer. Do you use antivirus software?
Yes.
Yes. Why do you use antivirus software?
To protect myself, my important documents, and also so that I can use my computer whenever I need to use. Otherwise, when it breaks down, it is very inconvenient.
So what happens if you get your computer infected by computer viruses?
Activate the antivirus.
Activate antivirus.
Yeah.
Okay. And if your computer is infected, such as our server infected by virus, what happened?
It will be quite a headache. So we have to find ways to clean it up.
Absolutely. You see, we protect our computer against viruses and worms and all kinds of hazards with antivirus software. But how many of you actually protect yourself against viruses and bacteria? And how do you protect yourself from all these infections? Because if your computer is infected by viruses, it's going to cause you lots of inconvenience. You may even lose documents, loss of man hours. But imagine now your own body is infected by viruses. What happened? You get a flu, you feel tired, you lose a few days of, a good life. You feel tired, you can't exercise, can't go to work. There are also viruses that cause more than just, crippling you for a few days. They can actually cause havoc, for example, hepatitis on your liver, for example. And now they say that viruses can cause more than just infections. There are reports that, in the past we thought that stomach ulcer, for example, gastric ulcers, were just caused by acid. But now it's known to be caused by bugs as well. Helicobacter pylori bacteria. So stomach ulcer is also caused by germs as well. And I just read in today's paper. There's an article, a very interesting article. It says that perhaps germs, viruses are actually controlling our brain as well. Is it possible? It says free will, that may be our germs at work. You heard of parasites, right? When a parasite attacks a host, the parasite is able to control the host and get the host to do what the parasite wants. You have seen the show called, the movie called Species? Once the species got into your body, it can actually control you. Perhaps, who you are, how you behave is due to viruses or bacteria inside your body. And perhaps your craving for chocolate is because there are bacteria inside you that crave for some food material, nutrients that are inside chocolate. So it's causing you to have the craving because germs are known to secrete some of these chemicals like dopamine, serotonin. These are chemicals that are also produced at the nerve junction, the ending of the nerve. So if these chemicals are produced in excessive amount, it can actually allow all these germs to control your brain as well in your behavior. So germs do play a part. Just like how viruses, when they infect your computer, can control your computer and cause you to lose information. Today, we are going to talk a little bit about sinuses and throat infection. We have a visiting consultant. Later, we invite our Dr. David Lau to come later on to share more about it. So these are some of the example of infection that have been caused by bacteria and viruses. What you are having here is actually the first slide of a finger is abscess. This is due to bacteria. Then the cheek, you can see this white spot down there. These are what we call tinea vesicolor. The Chinese call pétion. It's caused by fungus infection. Then the throat down there is caused by bacteria. Anybody can name me a bacteria? Any bacteria name you know? You got any bacteria friend?
Helicobacter.
Helicobacter. How about you?
Streptococcus.
Streptococcus. Any bacteria you know? Any bacteria friend you know?
I don't know.
Any bacteria friend? How about audience? Anybody? Any name of bacteria that you know? Or viruses that you know? Or fungus that you know? Anybody? You don't know your viruses. There's a volunteer there. Herpes zoster. Let's get the lady a warm applause and we can get her to come out and take one of these. Come. Oh, so she's speaking from experience. Thank you. Yeah. We'll pass you yours later on, all right? The three of you. And the last one, look at that slides there. That is oral thrush. It's caused by a yeast infection. Or this is the white slough. Yeast infection can affect your throat and your groin area as well. Okay, these are the danger that you see. This is an example of some of the germs that we're talking about. The first slide here, the spiky thing is a virus. And then the purple, long, cute looking thing is actually bacteria. Okay? And then, of course, some of you may be sleeping with bed bugs. You don't know? The bed bugs is as small as that. It's at the tip of the toe, the thumb there. And, of course, the others are all the bacteria. So these are some examples of bacteria. Of course, viruses are very small. You have to use electron microscope to see them. Okay? And, of course, the bacteria are slightly bigger. You can see with a normal microscope. And you can culture them as well. Then, of course, things like yeast, fungus, and, of course, bed bugs and so on, you can see them with naked eyes as well. So how do we prevent infection? I think you all know about the cause of infection: germs, viruses, bacteria, fungus, parasites, and so on. All these bacteria and germs need a way to get into the body. Anybody know how the germs get into your body? Anybody from the audience? How do you think germs get into your body? Stephen?
I think it's through contact.
Contact as in, how does it get into your body?
When you get a cut,
Yes.
the germs can go through.
That's right. It's through a break in your skin. You know, our skin serves as a very powerful barrier, like a firewall to prevent germs from getting in. So if you cut yourself, okay, the firewall, the barrier is broken, germs can just creep in, and next moment you may end up with a pus, an infection. Those are bacteria getting in the body. How about a flu? How do you think a flu get into your body?
To airborne.
airborne. It's through your mucosa, through your nose. You breathe in, the germs get inside, okay? And then it penetrates that. How about any other way do you think germs can get in the body? Food, that's right. That's how you get food poisoning. So if you are traveling or you are trying to go to a third world country, remember the water supply there may not be so clean. So you have to drink from bottled water, boil the water, and when I go to some of this remote part of Africa, I even make sure that I brush my teeth, okay, with bottled water or boiled water. There's no point trying to, be careful and drink only bottled water. Then when you brush your teeth, you go to the tap. And then, all the water will just go into your mouth and penetrate through your gum and you're brushing your teeth, all the mucosa are all broken. So these are precautions you should take as well. Any other way that germs can get into your body? Anybody from the audience? Nobody? Sexual transmission is one of them. Okay, blood transmission. For example, you go for a tattoo. Some of these people who do tattoo, they are not using clean, sterilized equipment. So you can get problems. Or you share needle, drug addicts. These are problems. Some doctors can even pass infections to you if they don't wear gloves and sterilize themselves well as well. So these are ways that infection get into your body. And of course, infection can only attack you if you allow it. Okay? And these are some of the mode of transmission that I mentioned. Portal of entry, like the card we mentioned. So the germs can get into your body through the lung, to the airway, okay, the urinary tract. If you wipe your butt, okay, try to wipe from the front to the back, especially for ladies. There are a lot of people wipe from the back to the front, and then because the gap between the urinary tract of a lady and the butt, where the feces came out from, is very short. So you tend to introduce germs and dirty things from the back to the front and end up with urinary tract infection as well. This is something that you can do. And of course, gastrointestinal means food poisoning, the food you eat, and so on. Be careful. And skin, when you got a cut or through the mouth, mucosa. And of course, mother can also pass the germs to the children, to the baby, like hepatitis B, for example. And of course, the other one is to blood, all these needle infections and so on. Germs can only attack you if you are susceptible. How do you make yourself susceptible? You run a computer without antivirus software, you're not protected. So if you are not protected, as in you don't take care of your health, you don't exercise, you don't eat healthy food, okay? And you don't go for immunizations, for example. Or you're down with cancer or HIV and your immunity is down, then when you are down, basically the germ will take opportunity to attack you, so you're susceptible. So one way to protect yourself is, of course, to make sure that you go for vaccination, okay, and exercise regularly and get lots of fresh air. And some of the common reservoirs for infections, I mentioned one of them, your handphone, your keyboard, the other one will be the toilet bowl. In fact, I understand that the keyboard actually has got 5 times more germs than the toilet bowl. And you type, and next moment you take your McDonald's and eat like that. So before you do that, you may want to clean your hand or wipe your hand with alcohol swab. In fact, when I go to the hawker center, I marvel at the way they wash their chopsticks and the spoons and forks. You can see stains of food and all that. I can even see lipsticks around the cups and so on, and lipstick marks. So how do you prevent? How do you protect yourself? What I do is I take this little alcohol swab. This is a little swab that you can get from pharmacy. Of course, now I understand BioCare has a new one that is not alcohol-based, so it doesn't cause drying on your skin and so on. But this is a little thing that you can buy from the pharmacy, and before you eat, you can just wipe your chopsticks and so on to kill all the germs. This is what doctors use to sterilize the skin before injection as well. These are so convenient, just carry around. When I went to Kenya, I carried lots of this around, because after visiting the cow dung hut, with my camera and all this thing, I have to travel another 600 kilometers back to Nairobi. And imagine your hand has handled all these children, the cow dungs and all these things, and you have to travel 600 kilometers. I know from Singapore to KL is about 350 kilometers, right? From Now you're talking about 600 kilometers inside the jeep that go, you cannot fall asleep. And you have to make sure your hands are clean. What do? I take out all this alcohol swab. I swab my camera, I swab my hands. At least I feel better. And during the SARS outbreak, I know, in 2003, I believe, I was literally obsessed with cleanliness. Before I leave my clinic, I would swap the computer, my handphone, and take up my belt, my watch, and so on to swap with alcohol. Because before I get home, you surely touch your hand or all these germs and so on, so you have to swap it as well. So these are little convenient way you can use to sterilize. Of course, the door knob as well, the public toilet, for example. These are things that you can do. Portal of entry, this is another one, sneezing. Okay. So to protect yourself, one way is to get yourself, your immunity strengthened, get yourself immunized, okay, and be aware of it. I want to now go on to the next part of our talk show. So I want to thank our audience who are on stage. Can we give them each one the bag? Joyce, can you help to give them? Come. Where are the goodies? One thing, can just get me one of these. Thank you for your participation, and I hope you have a good time. Let's give them a little goodie back. Yeah, take one each. And one for William. Okay, thank you so much. Today, we are very happy and privileged to have a specialist who has taken his precious time off to join us, Dr. David Lau, a well-known ENT specialist. ENT stands for ear, nose, and throat infection. Ear, nose, and throat, okay? Specialist. So let's welcome Dr. David Lau. Before we start, does anybody know the other name for ear, nose, and throat specialist? Anybody? Ear, nose, and throat. Huh? Orthopedic? Anybody, come. Ortho what? Laryngo. Anybody? Wow, okay, give her an applause. She's obviously done her homework before the talk, I think. Ortho, as in the ear, rhino, as in nose, and larynx, okay? So we have an ENT specialist here today to share with us something about our sinuses, our throat, our ear, okay? So with this, let me just get Dr. David Lau to just maybe do a bit of self-introduction.
Thank you very much, Dr. Low. I'm an ENT specialist. When I try and use the term otorhinolaryngology, it confuses everybody, and I also have difficulty spelling it as well when I write it down. So ENT is fine. I have a private practice in Gleneagles Hospital. I have been a practicing ENT surgeon now for over 20 years. I have a subspecialty interest actually in voice and throat and swallowing disorders. Although I also have some interest in sinus disorders, also thyroid disorders, and children's ENT problems.
Okay, so we have a specialist who is got special interest in things like voice disorder, swallowing disorder. So any of you have all this problem? Any of this problem, you can talk to him later on, okay? Free consultation. I'm just kidding.
That's fine.
You know, what does one eye say to another eye? Anybody know? Can anybody tell me what does one eye say to another eye? Don't look, I'm looking. Well, good try. Well, the answer is between us, something smell. So between the eye is actually the nose, and the nose is what, why we have a nose, right? We have a nose so that we can smell things. But behind the nose, there are lots of cavities. We call them sinuses. And maybe we'll get Dr. Lau to tell us what is this sinuses all about? What all these cavities for, and why do we even have them in the first place? I think you can just speak like this, right? You got a wireless mic, right?
Sure.
Yeah.
Yeah. So
Can you hear him? Yeah.
Okay. So the sinuses, as you can see on the picture here, are actually air-filled spaces inside the skull bones, and there are quite a number of them. So they're generally paired structures. So there are two of them, right and left side. They are inside the cheeks. They are inside the foreheads. They are between the eyes, and they actually go all the way back to the middle of the head. So if you look at your head and you think right in the middle of your head, there's actually a sinus air-filled space sitting in there. We are not entirely sure why they are there, and there are a number of theories. Probably the most likely reason why they are there is that they actually help us to resonate our voices. So when we speak, they actually help to produce that sort of more resonant sound. Some people think that they help our heads to float when we're lying in water.
Well, now you know why I cannot sing so well. Because I don't have good sinus cavity. Because my sinuses are not resonating very well. But I also understand that sinuses, some people told me that sinuses actually helps to warm up the air, as you breathe in. Is that true?
I think that is one of the theories. Although, if you look at the picture, you'll see that the sinuses, which are actually next to the nose, there's only a small space that allows the air to get in there. So most of the warming actually takes place in the nose itself. But nonetheless, they probably provide some degree of warming as well.
It's not fair for me to ask you this question because you're not vet surgeon. Does dogs and animals have sinuses?
Yeah, they do.
They do?
They do, yes.
And do they sing?
Do they?
Do they sing as well?
They bark.
They bark. Now you know why some dogs don't bark so well, right? Because the sinuses are not working properly, maybe like us. So that's why they probably can't sing. This meant to be a joke. Okay. Okay. What are the problems that people encounter, with their sinuses, and why do they get these problems in the first place?
Okay. Well, actually, the most common problem that people have with their sort of nose and sinus area. So, in fact, the lining of the nose is the same as the lining of the sinuses, and when you have a problem with one, you often have a problem with the other. But the most common problem is actually allergies. So people develop allergies inside their noses. Also affects the sinuses. Get a lot of sneezing, runny nose, blocked nose. And that is a little bit different from having a sinus infection, which is when the sinuses get blocked and you get bacteria forming and very thick mucus secretions forming inside the sinuses. So there are two main sort of groups of problems. One is allergies and one is infections.
So there are two main causes, basically, of all this sinus problem, allergy and infection. So how do we actually prevent sinusitis? We call that sinusitis, is it correct?
Sinusitis?
Yeah. Is it the same for allergy and the infection form, or there are different names?
Well, strictly speaking, if you have an allergy, it is due to one mechanism, which is due to you are allergic to something in the air. For example, you may be allergic to dust. If you have sinusitis, usually it is a result of some infection. And what typically happens is it may start with a cold. So you get a cold, and what happens is the drainage pathway of the sinus becomes blocked. And when it becomes blocked, all the mucus secretions get stuck inside the sinus. And then after a while, the bacteria kind of get stuck in there as well. And then you get infections. And then you end up getting pain in your sinus. You may get pressure. You may get a fever. Sometimes you get a lot of pus kind of draining out as well. Yeah, so two separate things, allergies and infections.
Anybody from the audience want to ask Dr. Lau a question on sinuses or sinusitis? Yes.
Is sinus curable? Is it curable?
Okay. Is sinus curable? Just because you may not be able to hear the questions.
Yes, it is. So what we have to do is to find out where the problem is, which type of problem it is, and how best to manage it. So is it an infection that we need to treat and clear? Or is it an allergy problem that we need to manage the allergy, maybe control the environment to stop the allergy affecting you so much, and possibly giving you some medications for that?
I remember when I was a doctor practicing a long time ago, my patients were so fearful of visiting all these ENT specialists with sinusitis, because they are so fearful, because they heard of friends who have gone through this traumatic procedure where they said they poke something into your nose and then the next moment they hear a crack and then all the blood gushing out. Do patients actually have to go through all these things when they have sinusitis, Dr. Lau?
With the crack and the blood coming out. Okay, usually if there's a crack and blood coming out, we'll normally do that under general anesthetic. And most of the time, most people do not actually need to take that route, but sometimes they do. Most of the time we can manage things. In fact, most of the time, if you have a sinus infection, it will settle down by itself. But if it takes a week or two and it is still not improving, then you may require some medications to treat the infection and help it to drain more easily. Very occasionally, we have to do the grant, and that one. Generally speaking, patients will be asleep when we do that, and that is basically to open up the sinus and help the mucus to drain out.
So aren't you glad we have such a thing called general anesthesia? Otherwise, you'll hear the crack and the blood coming out. So how do we, as laymen, or patients, prevent, ourselves from getting sinusitis?
We can't always prevent it. I think the key thing, however, because sinusitis usually begins with a cold, is to stop ourselves from catching colds and catching flus. And in order to do that, we have to keep ourselves healthy. And in order to keep ourselves healthy, we have to make sure that our bodies are we have the correct nutrition. We eat well. We eat healthily. We eat fresh foods and fresh vegetables in particular. We rest sufficiently. We minimize our stress levels, and we drink plenty of water so we don't let ourselves get dehydrated. So we keep ourselves healthy. Sometimes we may have to immunize ourselves against getting colds and flu infections as well.
So the key to staying healthy and preventing yourself from getting sinusitis is to stay healthy. Eat healthy food, lots of water, and of course, lots of fresh air as well. And one more thing, avoid crowded places, especially when there is a flu outbreak, right? And then if you like to shake people's hand, bring some, alcohol soap along and wash your hands regularly, frequently. It's very important. Otherwise, you shake the hand and next moment you go to your nose. And oftentimes when I was stuck at the traffic light, I look around left and right, wow, that guy is digging his nose. You never know what this guy is doing, before you shake his hand. So please, wash your hand regularly so that you don't get things like sinus infection and throat infection, okay? Let's move on to another area of our body, our throat. Have you ever looked into the back of your throat before? Anybody have looked into the back of your throat before? Never. You don't look at your throat, you just look at your face, ladies. I know ladies will love to look at the mirror and look at how it looks like. I even know one person who loved to look at the mirror with the eyes closed. I was just wondering why. Then I asked the person, I said, why do you do that? He said, I want to see how I look like when I'm sleeping. I was like, how does that work? Look into your throat. You may be able to notice two strawberry things at the back of the throat. Okay? These are what we call the tonsils. Okay? You know what does one tonsil say to another tonsils? They say, let's get dressed because the doctor is taking us out tonight. This happened once in a while when you got tonsillitis. Tonsillitis to the point, so bad to the point where you can see the two big strawberry structure at the back of the throat. Very prominent. Sometimes we pass on it. Looks exactly like strawberries. I can speak probably more like the specialist now because I can speak passionately because I have gone through that. I had bad tonsillitis before. I remember once in a while I have a high fever, and there was one incident where just before my Japan trip, I was down with high fever, and I look at my throat, wow, really pustular pus on a big strawberry structure. I got so tired of it, I told my 2 tonsils, get dressed. I'm going to see my friend, and they're going to take you out tonight. So I saw my friend, and they put me under anesthesia, and when I woke up, I thought, wow, that was the best sleep I ever had. So fresh after that. But then, just when I was about to swallow, next moment, wow, it's the pain in the throat is excruciating, you know. It's so sharp because the doctors have taken up my 2 tonsils and the surface are so raw, and they told me to take ice cream, drink cold water, and the more I take cold water, the more I take ice cream, the more painful it is. And it's like almost like drinking those icy cold drink, and next moment you get this burning feeling going to your throat and then shooting to your brain. So that was how I felt. And ladies, I got good news for you. If you want to slim down, no need to go and sign up for all these slimming packages. Just go and see your ENT surgeon and get your tonsils out. I'm just kidding. But, you know, when I had my tonsils taken out, I lost 6 kilograms within a matter of 5 days because I just go and eat. So what is this tonsillitis all about? And how do people get tonsils? Maybe let's start off with Dr. David Lau answering what are tonsils and why do we even have all this ugly little structure at the back? We can't eat them anyway.
Okay, well, they are, the tonsils are actually 2 structures that sit on either side of your throat, right at the back of the throat. And they are actually part of the body's defense mechanism. So they contain a lot of these white blood cells, which are part of the body's immune system. So they're actually the first line of defense. But unfortunately, because they're the first line of defense, they tend to get attacked first as well. So if you're getting a lot of problems, they're always getting attacked, they're always getting big and painful, and it's causing fevers. And it's happening frequently. In that situation, sometimes they have to be, not that they have to be, but you may be better off without them rather than having them there.
So have a look at your throat and see whether you have this strawberry little thing at the back. And now that I have my tonsils taken out, does it mean that now I have less immunity to fight, my body is less able to fight all these germs now? Because you just mentioned that tonsils are the first line of defense.
Yeah. So maybe that's a question that you may be better giving me the answer to. Because if you feel that you are getting more infections than you were getting before, then obviously that theory holds true. But what is supposed to happen and what generally happens is that the body actually has many other defense mechanisms. So once we remove the tonsils, it doesn't mean that you're more prone to infections. It doesn't actually stop you from getting sore throats, because everybody gets sore throats anyway. But it means that you don't get such bad and such frequent sore throats. But maybe you can...
Now I become the expert. I think I become an expert
experience.
Because from experience, yeah. Of course. I remember that those days when I had my tonsils, I had frequent sore throat and frequent bout of high fever. And ever since I took it out, and obviously the sore throat that was caused by tonsils infection is no more there. So from then on, I actually got less sore throat experience. And also I also have a less episode of high fever. Because every time I had tonsillitis, I actually had high fever, and it's very troublesome. It can disrupt your travel plan, your speaking engagement, and many, many things. So that is not to say that you must go and therefore go and see Dr. Lau tomorrow and take your tonsils out. No, I don't mean that. I mean, you can go and see your private doctors because they can also treat you antibiotic. Am I right?
Yes,
yeah.
Absolutely right.
Yeah. Treat you antibiotic, and this is probably one of those few occasions where you need antibiotics. Am I right?
Yes,
yeah.
It is. Yeah, and there is a threshold. So we don't take everybody's tonsils out just because you get a couple of episodes of tonsillitis. And what we have to balance up is how much problem the tonsillitis is causing you. So if, for example, if you are getting frequent tonsillitis, it's affecting your work, your speaking engagements, and so on, then you may be better off without them. But for someone who gets a mild tonsillitis and it doesn't really cause them too much problem, sometimes they can just be treated with antibiotics alone.
Yes. Tonsillitis could be also the reason why some people have bad breath. Bad breath could be caused by many reasons. One of them is got dental caries. Another one could be a bad tonsillitis or pass behind. So if you have bad breath, for example, you should see either ENT surgeon like Dr. Lau or a dentist to have a look at their teeth and also the tonsils as well. And I find that ever since I took up my tonsils, I have less problem with that as well. And it will definitely help. Of course, the indication for that to go for a tonsillitis is definitely not for slimming, all right? So just now was meant to be a joke. But of course, when you had the surgery, of course you lose weight because you didn't eat properly.
Actually, in patients who I remove the tonsils, I actually encourage them to try to eat more.
But they just couldn't eat because it's painful. It's not that they don't want to eat.
It is painful.
Yeah.
But what we do is it's actually quite important for patients to keep eating. Because when they eat, they actually produce saliva. The saliva helps to keep it clean and prevents infection of the tonsillectomy area. And that also prevents bleeding, which is one of the complications.
Well, this is the advice from a specialist. It's the same advice. Ask me to eat more, but then the reality is, you really can't eat because it's so painful. So I end up getting, taking porridge and trying to drink water and so on. And of course, the end result is lost a couple of kilograms. Well, when you have tonsillitis, that's probably one of the occasions where doctors have to prescribe you antibiotics. How about the flu? I often, when you see patients, they always ask for antibiotics. Does antibiotic really help when you have a flu?
Not really. In fact, it doesn't really help at all because flu is actually caused by a virus. And viruses are different from bacteria. They are also microscopic organisms. They also interfere with how our bodies function. But they do not respond to antibiotics. And flu is, generally speaking, it is what we call a self-limiting illness. It will generally, if you are a generally healthy person, it will get better by itself. There are various things we can do to prevent problems which can result from the flu as well. But generally speaking, antibiotics should not be used to treat flu.
So when you have a flu, what should you do? Actually, what kind of advice can you give to the patient?
When you have flu, basically you have to allow your body to recover. You have to rest. You might want to take some what we call symptomatic treatment. For example, if you have a fever, you can take some Panadol or something like that. If you have a sore throat, you can use some antiseptic gargles to help that. At the end of the day, you really have to just take some time and rest and let your body recover. Another important aspect of the flu is, obviously, when you have flu, you know that you're suffering so much, you don't want to pass that flu to the next person. And you have to take some precautions to prevent that from happening.
Absolutely. So if you see a doctor and you got a flu, please don't ask for antibiotics. It's not doing yourself a favor. Okay? What you need is to drink lots of water, lots of rest, and let your body recover because your body will fight back. And of course, if you don't have a flu and you're well, go for a flu jab. That will help you to cut down the frequency of flu as well. Let's move on to another topic, ear, nose, and throat, right? So one of the things we'll talk about is the ear. Before that, let's ask the audience a question. Anybody know why is it that during a thunderstorm you always see the lightning, then you hear the thunder? Anybody know? Light travels faster than sound. Give her a round of applause. Absolutely. But I have a friend who is an ENT surgeon, and his name is Dr. Beng. Dr. Beng. And the son came home one day and said, Dad, we have science lesson today, and the teacher asked me, why is it that during a thunderstorm we always see the lightning first, then we hear the thunder? Then Dr. Beng got so angry, he was saying to school for what? So simple, also don't know. Our eye in front, so we see first. Our ear behind, so we hear later. It's precisely the reason why our ear is behind. That's why sometimes we get into trouble with our ear. And because, some patient come to see me because an insect flew into the ear. Because the ear cannot see, ma. The eye is in front, ma, doesn't know what's happening at the back, ma. So because of that, you get sometimes once in a while a fly or insect getting in the ear. Anybody have this incident before? Any experience you can share? Anybody had a cockroach flying into your ear or middle of the night, you sleep and cockroach get into your ear? Have you got it before? No? Okay, let's ask Dr. Lau. Have you seen any patient with insect got into the ear before, and what do you do with them?
I've seen quite a number actually through the
Wow.
years, and I've been in practice for 20 years. So it doesn't happen every day, but I think sometimes these insects, they're looking for a home, and it's a nice little cozy hole to go into. But unfortunately, once they get in there, they sometimes get stuck and they can't come out, and it causes a lot of problems for patients because when the insect dies, it causes a lot of pain in the ear. So what we do is we have a microscope in the clinic, and we can basically just fish the insect out. So for us, it's fairly straightforward. For patients, it's a very not the most pleasant experience.
It's actually very traumatic to have a cockroach or insect flying into your ear. So supposing you're walking along the road and suddenly a bee just went into you because you think that's a home. So what should the patient do? Should they call an ambulance straight away, or is there anything they can do to stop the pain and all the discomfort?
Not really, Sometimes you can put something like olive oil into your ear and see if you can get the thing to float out. But very often with insects, because they have 6 legs or 8 legs, they kind of get stuck, and no matter what you do, you can't get this thing out, and you need someone to actually help you to take it out. Yeah.
That's right. You have to see a doctor, and let the doctor take it out, because we've got special tools, okay, to look at it. But how can any one of us, prevent such thing from happening? So we walk around with ear muff on our ear, or wear a headphone when you walk around, go jogging, Maybe that's a good idea when you go jogging in the forest, you should wear earplug, while you're enjoying MP3 at the same time. Is it advice?
Well, I think if you put earplugs in, definitely no insect's going to go in there. But having said that, I also go running in the forest sometimes, and it hasn't happened to me yet.
And you don't have insect going to your ear?
I haven't had it happen yet.
I can see that your ear is pretty big. And
there's enough space for it to go in.
You put some cotton wool inside or something? Often we all like to dig our ear and use cotton, but is it a good thing actually to do a toilet hygiene of our ear?
Okay, so we all like to do it. We all like to use cotton bud, and it feels
You
good.
mean you don't do that yourself?
A
bit personal, but,
okay.
but I mean from a doctor's point of view.
From a doctor's point of view, I'm supposed to say no. Okay, but everyone loves to do it. And I remember when I was a medical student, and this doctor said, one of the doctors came to give us a lecture, and he said, you never put anything in your ear other than your elbow, because it's not possible to put your elbow inside. But he said, actually, I use a paper clip to clean my ear. But that is the advice that I would give is that you really shouldn't try to clean your ears. And there's a number of reasons for that. So we all like to put cotton buds in. It feels very nice. It feels really shook, when you put the cotton bud inside. But actually what is happening is we're trying to clean the wax. But very often what we end up doing is we end up pushing the wax deeper inside. And not just that, but when we dig the ear, it actually damages the skin. And the skin, when it's damaged, it's easier to get infections. And it also stops the skin from transporting the wax out of the ear. So the skin of the ear is actually a little bit like a conveyor belt system. It keeps moving outwards, and it keeps shifting the wax out. And when we dig our ears, we're actually damaging that mechanism and pushing everything back inside. So the advice is, don't use cotton buds. Yeah.
Yes, we got a question. Oh, he used a metal.
So this is what is called going from the frying pan to the fire. No.
Okay, good question. We have a question here. How about ear candling? Is it a good thing to go for ear candling? People pay $50, lie down there for 15 minutes just to get the thing sucked up. Is it a good thing? What's ear candling anyway?
Okay, so ear candling actually involves putting this sort of tubular candle inside your ear, and you can lie on the other side, and you light the candle. And what is supposed to happen, it is by burning the candle, it is supposed to create what we call a negative pressure or a suction effect. And it's supposed to suck the dirt and the wax out of your ear. And what people do is, it feels very nice. It feels very comfortable, and it's like going for a massage. You know, you feel very good at the end of it. And what people have done is they open up the candle at the end of the procedure, and they say there's a lot of stuff inside here, and this is all the stuff that came out from your ear. You know, but some people have then gone and done some experiments. So they say, okay, we put the candle in your ear, and this is what comes out. What if we don't put it in your ear? We just light the candle and we open it up at the end. And actually what they find is the amount of stuff inside the candle is exactly the same. So the reality is it probably doesn't bring anything out of your ear. But it can, and there are quite a number of reported problems with ear candling. So when you're lying on your side and the ear candle is burning here, occasionally the ashes can drop onto your face, and you can get some burns. So what people do is they put a plate there to stop the ash from dropping. So that solves that problem. But then the other thing that can happen is the wax from the candle sometimes actually drops through, because it's a hollow candle, can drop back inside the ear, and instead of actually clearing the wax, it actually adds new wax to your ear. And there have been instances where people have actually ruptured their eardrums because of this, either pushing it in too much or because the suction effect is too much. And there have also been reported cases of people actually burning down their house. And this is completely true, because they fall asleep and the candles burn, and things happen as a result of that. So as a result of this, the overall effect is that ear candling probably doesn't do that much other than make you feel kind of nice at the end, because it's relaxing. And in fact, just to give you an idea, in Canada, this particular issue of ear candling has been looked at from the medical, from the health board point of view. And they classify ear candles as what we call a Class 3 medical device. And a Class 3 medical device is something like a hip replacement or a dialysis machine. So in other words, some device that actually can injure your body, and it requires licensing. And the government in Canada refuses to license ear candling, and therefore it's actually illegal in that country. But nonetheless, people still do it in other countries, and they like it, but we have to be very, very careful about doing it.
So ladies, when you go and sign a spa package, please take out the ear candling, because that chap is using an unlicensed Class 3 medical device. And Class 3 medical device is tantamount to saying that you actually operate on the hip and, putting something inside. That's actually quite invasive. And of course, like what the Dr. Lau says, it's full of danger. It could even burn down the whole HDB flat, you never know, and you'll be in the paper. So let's stop that. But how do we then get rid of earwax? Because you say we cannot dig our ear, we cannot go for ear candling. Can we go and see a barber and get them to dig it out for us?
Well, it's the same thing. And so actually the ear is designed to actually clear its own wax. And it does this by the conveyor belt mechanism. So the skin actually keeps moving outwards, and it transports the wax with it. And in fact, we don't really want to clear all the wax anyway, because the wax actually forms a layer, and it protects the skin. It stops infection from actually getting through the skin. It's like putting some protective creams on, but you don't need to do it because it's a natural thing. So it actually clears by itself. But if you are having difficulty clearing it, and some people do, the skin doesn't move so well, sometimes you can put in some wax dissolving drops, or even something as simple as olive oil. And if really it's blocking up a lot, then you may have to get a doctor to actually clear it for you. And we do that with a microscope and a suction, or some doctors actually flush the wax out.
Yes.
Yeah.
So you learn from today that you should not be trying to dig out your own earwax, or get a barber to do it, or get a ear candling technique to do that. You should actually see a doctor, and the doctor can prescribe you simple things like olive oil, wax saw, for example. They can drip on it. It helps. But if in doubt, you can always see the doctor, and they can look under the special tools called the oroscope, and then if it's really blocked, they can try to syringe it out, or go and see a doctor with a microscope like Dr. Lau, and he can dig it out nicely as well. These are the non-traumatic way of doing that. Of course, how about ear infection? Do we get ear infection from swimming?
We can. If we're swimming in contaminated water, and a lot of the time the water that we swim in, actually the bacterial counts are actually rather high.
In Singapore?
In anywhere, and particularly in the sea in Singapore,
okay.
the bacterial counts can be very, very high. But nonetheless, not everyone will pick up an infection. Some of the things that may make you more prone to getting infection is, in fact, if you're trying to clear the wax, because the wax actually protects the skin. So after you've been swimming, the skin is a little bit soggy, and then you try to clean out the water, and then you're damaging the skin, and that's when the infection tends to set in.
So if you are going for swimming and so on, try to avoid the seawater and go for, our swimming pool where there's some control on the cleanliness of the water. And if you do have an infection, see a doctor. The doctor can prescribe antibiotics, right?
Yeah.
Okay, and try not to dig your ear too much. So you can go home and throw away all your cotton bud. Right? Shouldn't cotton bud therefore be considered a class 1 or 2 device?
Maybe it should be a class 3
Yeah.
device. But I actually, because the patients that come to see me, typically by the time they come to see me, the ear infections are really bad, and you can't just treat them with simple antibiotics. And one of the recommendations that I give them is, I think it's time to take all your cotton buds and put them in the dustbin. And very often, one of the reasons I do this is not because they're just digging their ear, but also because we tend to keep our cotton buds in the bathroom underneath the sink. It's very damp, and they pick up fungus, and then the next thing you know is you've got a fungus infection in your ear, and those are very, very difficult to treat. So overall advice is actually best not to have any cotton buds at all.
I will find it quite difficult to accept.
Most people
because,
do. Yeah.
Because like you,
yeah.
it's easier to talk about it. And when we practice at home, after a shower, you feel that it's very wet. You just wanted to dig it out. It's kind of a habit, an obsession after a while.
Yeah.
So, but having attended to this talk show, I probably have to start thinking about getting rid of all my cotton buds. But how about if I fold my tissue and make it into like a cotton bud?
Well, that's just substituting one for the other. I think, most of the time we get away with it, and we all like to do it. It feels good. But it's when you get that infection and you know how bad it is that then it's time to. Then you know that it's really time to.
And cotton buds sometimes get dislodged and get stuck in the ear canal. You can see the picture there. The canal actually is very narrow. So if you get cotton bud dislodged inside, don't try to dig it out with another cotton bud or a needle or a paper clip, because you're just going to push, right, the bud further in. And what's behind, going deeper down, what is that? What is that little eardrum there?
So it's a little membrane.
Yes.
And it's a very thin membrane. And if you put sharp things in your ear, very easy to damage that or even make a hole in it.
Yeah. So if you get your cotton bud stuck inside, you should see a doctor, okay, and he can try to take it out. If the doctor cannot take it out, he can see an ENT surgeon, and he will look under the microscope, and they have special tools that can just pull it out gently. So don't try to push it further in, because you may perforate the eardrum, and then you have another problem. We call that the middle ear infection, right?
Yeah.
Yeah. What is middle ear infection? How does the person get infection in the first place?
Okay, so a middle ear infection is one that occurs behind the eardrum. So where you see the eardrum on the slide here, it occurs on the right side of that. And usually that happens because of some problem in the nose or back of the nose area. And the reason that this happens is that the nose is actually joined to the ear by a little tube.
You want to point to the little tube there called the...
Yep, so it's...
let me do it up for you.
Okay.
This is the eardrum. Okay, this is our ear, of course, and this is the ear canal, eardrum. Inside here is a little space, we call that the middle ear, and this is the tube. Okay, is there a name for the tube?
That's called the eustachian tube.
That's right, the eustachian tube. And where does the eustachian tube connect to?
So that actually goes to the back of your nose. And if you're having problems in the nose, so for example, you're having bad sinusitis, and there's a lot of infection in the back of the nose, and you blow your nose very, very hard, or you suck the mucus in, you do this sort of thing, then it sucks everything back, and it actually helps to transport those bacteria or viruses up through the eustachian tube into the middle ear. And that can sometimes result in a middle ear infection as a result of a nose problem.
The eustachian tube is a tiny little canal that connects the middle part of the ear. We call that the middle ear, which is the air-filled cavity, right?
Yeah.
Okay, to the back of the throat. It's helpful in equalizing your pressure. You feel it when you're flying. Okay, that's why we have to blow our nose to clear, because otherwise you find that the pressure built inside. And of course, when when that tube gets blocked, then the infection can build inside the middle ear. That's when you get severe pain. Am I right?
Yes.
And you have to see somebody like Dr. Lau and get it treated. So what can we do really to prevent that, other than not sucking in, making that noise?
Well,
Does frequent flying, for example, cause you to make you more prone to middle ear infection, for example?
Not necessarily. So there are people who fly very, very frequently and do not run into problems. But I think what is important is that when you're landing in the airplane and you start to feel that pressure pain in your ear, you may want to equalize the pressure. And one way to do that is to actually pinch your nose and just gently blow a little bit. And while you're blowing, you swallow. And when you do that, in fact, if you try that now,
you can try that now.
So you just pinch your nose, just blow very, very gently to build up some pressure. And then while that pressure is there, then you swallow. And you should hear a little click in both of your ears. And that's an indication that the pressure is equalizing. And if you do that gradually as the plane is descending, then you shouldn't really run into problems. Having said that, if you are somebody who has problems in the nose, then you may need to get those problems treated, because it can be harder in that situation to equalize the pressure.
When you fly, oftentimes near landing, you hear a lot of baby crying and so on. Are they crying because of this problem?
A lot of the time they are. And what you can do is you can actually go to the mother and say, I think it's time to have some milk, and they'll start sucking on the milk, and then you'll find that they often quieten down and they're okay. And they'll be very thankful to you.
So this is a good tip. If you're flying and you find that a lot of crying and it's very irritating you, do yourself a favor. Don't get irritated. The poor baby is struggling to equalize the pressure. It's painful for the baby. Do yourself a favor, and for the baby a favor, and the mother a favor, by asking the mother, it's time to feed the baby or something, or suck the thing.
Yeah.
Okay, that will stop all the crying. Okay.
Yeah.
Because oftentimes when we fly and we get very irritated by all this crying and so on, it's really because they can't equalize the pressure, because baby cannot put the hand like that and try to blow. Okay? They're not like us, So pity the poor baby. Okay? Okay. Are there any more questions that you have for Dr. Lau?
Swimming, right?
Uh-huh.
Can you do the same?
When you're swimming?
Yeah, when you're swimming and there's water blocking your ear,
Okay.
and then how do you get rid of the water?
Okay, so if it is just water in the ear canal, which we see on the picture here, so in other words, it hasn't gone beyond the eardrum.
You just hit your ear.
Well, it's probably probably a good idea not to hit your ear too much. But one thing, you can jump on one leg, and sometimes that helps it to come out. Another way is when you get home, you just lie on your pillow on that side, and it tends to, gravity helps the liquid to come out. If you are, on the other hand, going diving, so you're diving underwater, then you need to learn how to do an equalizing maneuver to equalize the pressure so that you do not damage the eardrum. So if you take up snorkeling or scuba diving, then that's a maneuver that they will teach you how to do. Yeah.
Okay, we have, yes, question.
Sorry, on the ear thing again, yeah, I'm what do you call that, cotton bud. I agree with you, it's very hard to get rid of not using the cotton bud. Okay, what about wet? People have got dry one and some have got wet. So every time there's a little wet thing there, you just leave it.
Well, what is wet ear in the first place?
Wet ear, yeah. Like mine, it's like always wet, so that's why it's very easy to just get the cotton bud to kind of like,
Yeah.
what do you do with it? I mean, you don't use cotton
And
bud
do
right
you
now.
find anything comes out when you
I mean,
clean?
yellow, you know,
A little bit
usually like
yellow.
the-
And,
yeah.
yeah. So in fact, what you may be experiencing is just a slight liquefaction of the wax. So the wax is becoming a little bit liquid. Maybe the temperature is warm, and it is coming out more easily. And really,
Just leave it, don't use
actually, you can just leave it alone, and
then
it's
you'll
fine.
find out,
It,
then it's kind of like-
yeah, it'll eventually come out on its own, and may not be necessary to do anything actually. Yeah, you know, very often it's a little bit like scratching. You know, the more you do it, the more you have to do it, and the less you do it, the less you.
It's
you
quite
have to-
satisfying, right? To
It
scratch.
is.
Sorry, second question
yeah.
is on the sinusitis because I've got 2 kids who always have this kind of problem. When it's all bunched up, you know, what is the best way of relief? Because I read about liquids that you flush the nose and sort of things, you know, like all bunched up. I know you have to go through a process of healing and stuff like that, but what's the best relief?
How old are your kids?
End of almost 20, 21, they're not 5-year-olds.
Okay,
Yeah.
so almost grown up.
Yeah, grown adults. Yeah.
21's are kids.
Almost like maybe 19, 20, or rather they had it when it's young.
Sure.
Now, you know, adults.
So it's an
always
adult
have this
who's-
problem, yeah.
Yeah.
So
Well-
what is the best relief? You know?
I mean, just the simple things you can try would be the flushing. So really the simplest type of thing is flushing with saline or some sort of sinus or nasal rinses. And there are a number of them available on the market. So these are non-medicated compounds. It's a little bit like having a shower. You're just washing out some of the mucus and sort of pollutant particles that are in the nose.
The other thing I do is also like the face mask.
Yes.
Inhale.
Face mask with
Sorry, not face mask. The steamer.
steam. Yeah, and that's fine.
Put a few
That's
drops
fine.
of, like, eucalyptus and then you
Yeah.
just kind of inhale.
Yeah, and that's okay. I think there's absolutely no harm in doing that sort of thing, as long as it helps. But if it's not helping sufficiently, then it may be necessary to have get them to have a look at their noses and see what is the reason for this sort of bunged up feeling. Is there some sort of anatomical reason for it, or is it something that may require some sort of medication? And one of the medications we often use are actually steroid nasal sprays. They're very, very safe to use. So we shouldn't be put off necessarily by the word steroid. They are very safe to use, and they can be quite helpful in getting the nose to open up. Another aspect of this is actually there could be some allergy involved. It may be worth finding out what that allergy is, and some testing, simple testing can be done, and then doing some avoidance measures. Yeah.
Great. We have come to the end. Yes, one last one, and that's it. Still cotton bud problem. Okay.
Well, actually, what I want to ask, yes, I understand we should not dig because it will drive the wax backwards and we may scratch the skin and so forth. But what if you use the cotton bud in such a way that we just dab the wetness? You know, after a bath, your hair is wet, your ears are wet, so you just want to get rid of the moisture. So can we just use the cotton bud and kind of dab it and not scratch it? Is it okay?
There's a die-hard cotton bud.
Yes, that's right. That's right. I find that difficult to argue with.
Yeah, the same problem, right?
So yeah, this is what we call different shades of gray. Yeah.
Well, I must confess that I'm also a die-hard cotton bud user, and it will be a struggle to get rid of cotton bud. Of course, as doctors, we know all the dangers, and I always tell myself, as long as I'm careful, I just want to get rid of the dampness. But one way you can probably try out is to blow your fan. You get your fan blowing into your ear. It may help because it's basically air circulation, and it may just get rid of the vapor and so on, the wetness. Rather than poking a cotton bud in and then getting stuck, and then you have to go and see an otorhinolaryngologist. With this, ladies and gentlemen, I want to just ask you to thank our Dr. Lau. And before you go, I understand there's something for me to give to Dr. Lau as a token of appreciation. Can we just No, you better present it.
Okay.
Thank you.
Thank you.
Thank you.
Thanks.
Very
Let's
nice.
take a picture together. Come.
One more. 1, 2. Thank you.
Thanks a lot.
Thank you, sir.
Yeah, can taste this. Understand we have another goodie for everybody. Joyce? Where's Joyce? It's a what? Lucky draw or something like that?
It's a draw, then we have 2 prizes.
Okay. It's a draw and 2 prizes. Can I invite our chair lady, Cecilia Tan, to come on stage? Come. Draw one number first, okay? I can't read the writing here. Who is this? Jack How? Wow. Okay, Cecilia will present that to Jack How first. Take a picture.
Okay, 1, 2, 3.
Okay, next one. What's the name? Kai Chuan. Okay, thank you, Cecilia. We have come to the end of our first talk show. I hope you guys have enjoyed yourself. We hope to organize this regularly, and I hope that you will do your part if you enjoy this talk show. Okay, what you can do to help us? Go to our Facebook, facebook.com/MHCAsia. We'll be posting some videos and photographs, on our talk show. Go in and like that post and share that. And if you like the whatever have been shared and discussed today, make a comment, okay, so that more people know about our talk show, so that the next talk show we could have more people coming here to join us, okay, and then hopefully with this talk show we can help to make a difference, to keep people healthy, because we are bombarded with lots of advertisement out there, newspaper, TV advertisements, and so on. A lot of them are just trying to hard sell you things, ear candling, cotton bud, and you didn't know that cotton bud is so innocuous, but it's causing so much damage to the ear and making our otorhinolaryngologists very busy, right? So do yourself a favor, do your friend, your loved one a favor, go to our Facebook, share it, okay, and watch out for our next talk show. And I want to thank you for coming, and I hope to see you at the next talk show. There'll be more topic, more exciting team coming up, okay? So with that, thank you so much. Is there a refreshment for everybody? Yeah, I think Joyce has prepared some refreshment for you guys as well.